Good afternoon. Welcome once again to the Community Safety Advisory Commission. This is our 10th meeting. And again, thank you to the commissioners for your sacrifice of giving of your time away from your jobs and sometimes your families. I know it's somewhat challenging. I know that we're missing a couple of commissioners today because they had work commitments that they just couldn't move, and so they will not be with us, and I'm not sure about some others. And always thank you to the staff and all of those who support us. We actually have two sets of minutes to approve today, September the 12th and September the 25th. And I want to give a huge shout out to Denise Bauer, who prepares our minutes for us. These were very, very, very detailed, and I appreciate that. Ellen, I don't know if you had any oversight. I think you volunteered at the last meeting that you would, so thank you for that. Any comments or concerns about the minutes? Then could I have a motion to approve the amended minutes from the September 12th meeting? So moved. Second? Second. No further questions? All in favor, please indicate by raising your hand of approval of the minutes. The minutes are approved. Now moving to the minutes of the September 25th meeting. Any questions or concerns? May I have a motion to approve? So moved by Reginald Wilkinson. Second? Second, thank you, Mr. Luther-Waugh. All in favor, indicate by raising your hand. Thank you. The minutes are approved. It indicates here that I was going to talk a little bit about the structure of the meeting, and I think it's pretty straightforward. And thank the commissioners for a very robust meeting on September the 25th. Because we delved into so many details and maybe changed up when we needed to, and we actually extended the meeting a little bit, because of the materials that we were receiving and the questions, we had to move Lieutenant Dennis Jeffrey to today. And so the lieutenant was there, ready to go, but graciously agreed that he would come back and join us today. So he's going to present. We'll have, again, it doesn't indicate this, but he will present, and then we will have questions from the commissioners. At that point, we will take a brief break, and the day has finally arrived when many of us have been anticipating. We will actually have the opportunity to meet representatives from our consulting firm, Matrix Consulting, and Brian will introduce them. You can see that they are scheduled to, I'm assuming, to give us a very thorough overview of their anticipated work, because it indicates that they will be sharing from 2 to 3:30. Then we'll have an opportunity for discussions and additional questions from the commissioners. And so with that, we are prepared to hear from Lieutenant Dennis Jeffrey. And again, thank you so much for your patience.
Pleasure. So good afternoon. Once again, I know Commander Meter kind of talked a little about me last time. I've been with the division for 23 years, 17 of that as a supervisor. In 2014, CIT, which I'll talk more about, crisis intervention, was a part-time position. I was a patrol lieutenant, and I also was a CIT coordinator. Once I gained that position, we realized, and the chief realized, that due to the complexity of these issues and the amount of runs that we were taking, that it might be a good idea to make it full-time. So in 2017, this became a full-time position for me. So I'm very happy that happened. So I want to talk about crisis intervention team, and I'll talk more about what that is, but as you can see on this slide, there's some other items that stem from that. So what we've done with CIT, we've obviously used a foundation that's nationally recognized. We've also developed some programs that are innovative in themselves, and I think have really expanded the concept of what the training is all about. So if y'all can indulge me for one moment, I'd like to go around the table and just ask a brief question. And you certainly don't have to answer if you don't wish to, but I can tell you why we do that. And this is the first thing we do when we do a CIT training with the officers. So I just like to go around the room and ask everyone, do you know of anyone with a mental illness? And if we could just start around the table.
Yes.
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 Okay, so that's 100%. So the reason we ask that question really doesn't surprise you. And actually, the statistics, you'll see 1 in 5 people in the United States, that's 43.8 million people, or 18.5% of the population, have a mental illness. So that stat, I think, is way low, as we kind of just learned from this, introduction. It's something in our society that's very prevalent, and it's not only prevalent nationally, but it's prevalent in the city of Columbus. As you can see by this slide, that based on those numbers, we have about 162,000 people in the city of Columbus with a mental illness. That fills 1.5 Ohio stadiums. It's pretty amazing when you think of it from that perspective. So it is an issue that's growing. We're continuing to see more runs, calls for service for these issues. So I just thought it was interesting to kind of show you a perspective of what we're encountering. So how did CIT get started? Like I said, it's Crisis Intervention Team Training. So you can see by this article, this was back in 1987 in Memphis, Tennessee. This started the CIT movement, if you will. So on September 24th, 1987, Joseph Robinson was an individual with schizophrenia. He was male, he's 27 years old. His mother called the police because he had an 8-inch kitchen knife to his throat. She said he was possibly suicidal. The officers arrive. After a very quick encounter, he lunges at the officers, and he shot multiple times, and he passes away. So that really started, the community of Memphis said, we're seeing more and more of these, and this is 30 years ago, mind you. We're seeing more and more of these situations, and our officers have been trained a certain way, which I know you all heard about training at the last session. Sometimes that traditional police training probably wasn't always the right way to approach these. That's how CIT came to be. A group of people in Memphis, a community, got together and said, we want to work with the police to try to make these situations better, more effective for the officers and the community, so people are safer, both the officers and the community. So just real briefly, CIT is a 40-hour course, but here I just wanted to show you the curriculum. Basically, this is so over the 40 hours, we cover signs and symptoms of mental illness. A psychiatrist from Ohio State comes in and talks about that. Risk management and net care. I assume most of you have heard of net care. It's our crisis center here in Franklin County. They come in and talk about, their operations. Implications of mental illness in youth, which is a whole different ballgame for those of us that have children. It just complicates matters more when we're dealing with children with these issues. Pink slips and probates. Has everyone heard of a pink slip? So that we have a doctor from NetCare also talk a lot more about that in probates, because that's the one issue. Pink slips and probates become very complicated, as well. I'll talk about a little bit. Dual diagnosis, mental illness and substance abuse. As we know in Franklin County, we're in an opioid epidemic, so we've kind of added that on to our training, because obviously sometimes mental illness and co-occurrence and drugs go hand in hand. And I said we talk about opiate and Narcan education. We talk about the Franklin County ATOM Board, which you're not familiar with the ATOM Board. In Franklin County, basically all funding for mental health and addiction services come through the Franklin County ATOM Board. Then they decide where that money goes. So they're very important in our community, and they're a big partner in CIT. Crisis intervention for people with developmental disabilities. Well, we have a family panel. So when I went through CIT in 2004, I went through as a sergeant because I got frustrated because my officers were coming to me and they're like, hey, Sarge, we're going on these runs, we're not sure what to do, where do we take folks, we're not sure we're doing the right thing. So I went through it because I wanted to, have the knowledge that I could give to them. And what we did in CIT is we bring in family members of folks whose children have mental illnesses. And it really gives you a perspective, because I think a lot of times officers go on these runs and they get we're going again and again, what's going on behind the door. This gives them opens that door basically to see what's going on in that family's life day to day. So it really opens your eyes, and I think, like I said, that perspective piece is really important. We also do a hearing voices simulation where the officers wear headphones, and a psychologist develops an exercise where you hear voices that simulate auditory hallucinations. Very important, because if you're talking to someone and they may not seem like they're getting what you're talking to, it could very well be they're having auditory hallucinations. So the officers get that perspective piece once again. Another important part, they ride with a case manager for 4 hours in the afternoon. They literally go out everywhere that these case managers would typically go during their job. And once again, it's a big eye-opener because they realize these folks are in a really tough job. They're going out by themselves typically to a lot of these places, and so the officers can see that as well. We also do a cultural panel. Obviously, Columbus has a huge different cultures, so we bring in folks from different cultures to talk about mental illness because it's different in every culture. So we want them to understand, the Somali culture Ethiopian culture, Hispanic cultures, what mental illness looks like, and what are some strategies that might work with those cultures. De-escalation skills, that's kind of the big buzzword a lot of times. What does it mean? I'm sure if we were around the table, all of us would have a different definition. It's really slowing down to get the person to be able to communicate properly with us, so we understand why we're there, what we can do to help them. So we do a course on that. Legal review, we talk about case law that's impacting mental illness. We have a class on PTSD and veterans. We have a huge veteran population in this area. And lastly, on Friday, we do role plays where we literally bring it all together, have them do role plays. And our role players are folks that work in the mental health community. Some programs have paid actors. They don't usually go that well. These folks see it every day. They're able to emulate those behaviors, so it's been really effective. So CIT it's governed by CIT International, and they have some key elements which every CIT program is supposed to have. So the first is ongoing elements, partnerships, which are huge. We couldn't do it alone, much like they discovered in Memphis back in the 80s. Community ownership and policies and procedures. So our partners, you can see, it's kind of hard to see. We have a lot of partners in Columbus area, and what's even more sometimes confusing for officers, who do I go to? As you can see, there's probably 30 different providers on there. Sometimes it's very hard to navigate at 3 a.m. Where do I take this person? So a lot of times it's very important to give the officers the resources to understand where folks can go, where you can take them to get them better treatment. Our division directive, just real quickly, obviously we have a directive just for mental health, and basically our goal when a run comes in and it's determined a mental health run is to get a CIT officer there. That's in our policy. We're about 50% of the time we successfully do that, which is, I think, pretty good considering the amount of runs we've had. In 2017, we had 18,000 mental health runs. So if you think about the scope of that, those are 2 officer calls. That's a lot of resources. So we try to get a CIT officer there so that added skill sets available on these situations. Operational elements, obviously, this is what you have to have CIT officers. Dispatchers are key. We do an 8-hour training for our dispatchers because really that call is critical. What information they get from that call really dictates our response. So a lot of times, the more they can drill down and ask questions, hear certain behaviors, it helps the officers when they go to these calls for service. The mental health receiving facility, as you see, is a huge issue in this county. We have some great providers, don't get me wrong, but they're overwhelmed right now with, as you mentioned, 18,000 calls for service. Of those, 50% result in a transport. Well, where do we take folks? Netcare, as you know, is kind of our first option. That's their expertise, but due to capacity and they're not a locked facility. So sometimes we know someone's shown violent tendencies, we don't want to take them to Netcare because they can walk out. So what do? We go to the ERs, mainly OSU and Riverside. So there's some talk of having a mental health facility that's locked down, a one-stop shop, if you will, where someone could go for medical and mental health. That's something in the works. So hopefully that's something that we'll have in Franklin County soon. And then the sustaining elements, evaluation and research. That's kind of like what I do. I look at calls for service a lot. I watch body cam. Did we do everything we could have for this person? Is there other things we can do? Data is a big part of my life. In-service training, we incorporate mental health and in-service training. Recognition and honors, I try to make sure our officers that do a good job in these calls get the honor and recognition they deserve. And you can just see here, this is Sergeant Matt Harris, who works up north. Phenomenal sergeant. He goes on every mental health run he can with his officers. So it's really key to have that supervision there to make a further assessment. He received the 2017 NAMI Officer of the Year. This is Officer Ed Chung. Ed works the Hilltop area. CIT officer, he's phenomenal. He's had over 30 Narcan deployments. And this was what he got an award for. And what the most interesting part of this award ceremony was, it was on a Sunday. I was there, and a gentleman came in, and he looked like kind of didn't know really what was going on. And he sat down, and when Ed introduced me to the end, Ed had used Narcan on him the Friday before. So he'd asked him to come to the ceremony. I thought it was pretty amazing that he took the time to come and support Ed. So the mayor's office, one of the goals is to get to about 50% CIT trained. And those are what we call front-facing officers, meaning officers that are pretty much in patrol or in uniform that actually will respond to the community. So as of right now in 2018, this year, at the end of the year, we will have trained 95 officers. So that puts us about 426 total CPD officers that are CIT trained as of in December In order to reach, will be about 38%. The goal now is as recruit officers get out of the academy, go do their field training period, and come back after the field training period, they too will go through CIT. So that puts us, if we continue to have 50 classes, 250 officer classes a year, that puts us at about 626 officers by 2020, which is the goal. That's 56%. That'd be a pretty incredible number if we can achieve that, which I think we can. So it's just a de-escalation tree. I know there's a lot of versions of this, but really what are we doing when we go on these calls for service? And really we have to determine what's the crisis. And if there's violence, a threat of violence, it changes. We have to address that violence first before we can de-escalate, if there's a weapon involved. So obviously if there's violence, you go one way. If there's no violence, then we say, okay, how do we now delve down to get this person help? And that's really where we're de-escalating and then getting them to the point of service they need. So just a real simplistic way to kind of show a basic run what an officer's kind of breaking that down and trying to assess the situation while being safe for not only the officer but also the community, but also getting that person to the help that they need. I mentioned this is a pink slip. It was in the original packet you all received. It is pink. No one knows why it's pink, but it is pink. You notice there's 4 criteria at the top, and those are really what that officer has to assess. And I always break it down where I think we do a really good job training our officers, but in the moment, they're really acting as a clinician. We're asking them to go on a call for service at 3 in the morning, have a very small fact pattern, deal with that individual, and then really determine, do I need to take them somewhere? And if I do, are they going to go voluntarily with me? The pink slip, we're very fortunate in Ohio, gives the officers that ability to do that. Some states aren't that fortunate. They really have to struggle with getting people to a place of help. So we're very fortunate to have that at our disposal. So we talk 2 key concepts of CIT, or empathy and perspective. I already talked about perspective, and we do this during the training. We show that first question I asked you a lot of times is to kind of break that stigma. That a lot of people are, I'll be honest, you were very gracious in your answers. A lot of officers don't want to answer that. There's still a lot of stigma with mental health. So we got to get through that first to understand that. And then we build the empathy. We want the officer to kind of understand what that person's going through so they can better assist them. So if you would just take a look at this slide, you may have seen this before, but just take a quick look at it. And this was basically a social media post. An individual, it's at the Kroger at North Broadway and High, and an individual came out and saw this, and they snapped a picture and said, this is, if you can read it. On its face, if I were walking out, I might look, well, this guy's just sitting there minding his own business. What's the big deal? So I think it's important to, once again, bring in perspective. That the person that snapped the picture had a perspective, the officer had a perspective, and obviously the gentleman, his name is Johnny, had a perspective. So I'm going to go ahead and, hopefully this works, play a little bit of audio.
911, what's the address of your emergency?
I'm not sure what the address is. I'm at Kroger's on High, I think like High in North Broad.
Hang on, Kroger. Can you ask someone the address?
Yeah, it says High in North Broad, North Broadway.
Hold on. High in North Broadway.
Yeah, the Kroger's.
Okay, what's going on there?
What'd you say?
What's going on there?
I cut myself, and I don't know if I need some stitches or not.
Okay, did you do it on purpose or accidentally?
I did it on purpose, but it didn't work.
What's your name?
Johnny.
I'm sorry?
Johnny.
Okay, where are you going to be at? Are you going to be out front of the Kroger?
Just standing on the side of Kroger's where
So I played that call. That was the 911 call for that situation you saw at Kroger. So, and I played that because you see the perspective piece come in now. You see a very quick call. And a lot of times these are that call, so if you're not familiar with Columbus, we have call takers. When you call 911 or 645, they're the ones that answer your phone. They're trying to get information very quickly, especially if we have a situation where someone says they cut themselves. We need to get help there immediately. But you can see, and I played that the whole way through. A lot of people think the audio is bad, but really what she's doing, when he says he's at the high at Kroger, at Broad and High, there is no Kroger. So she probably realizes that. She's trying to put it into the system to see where he's at. He eventually says, I'm at Broadway and High. She asks more questions and the call drops, and she tries to call back, and no luck. So I just play that because this exactly, if you look at this screen, if you've ever seen one of our dispatch calls, is what the officer gets. As they're driving, he sees the male cut himself, he's standing on the side of Kroger, what he's wearing, cut to his wrist, and that's about it. Doesn't know anything else about this individual. Is he still armed? Does he still have the knife? We don't get to that point. So that officer shows up at Kroger. Johnny's sitting on the ledge, and that's what he has to work with. I show that because you'll see, and this is just a blow up, and did anyone see the gun behind his back? I know it's hard to see. So a lot of people saw that and were very, somewhat, well, that's not uncommon if he has a knife still. The officer's has his gun behind his back. If the individual were to get up and come at him, he still, he doesn't have it pointed at him, but he has it ready. So what happens, that's Officer Miracle. And what's interesting, Officer Miracle graduated the academy July 7th of 17. This happened in January of 18. He's got like 4 months, really. He did go through CIT in the academy. So Officer Miracle waits for backup, which is what we teach. Slow down, right? Because when we talked about the very first situation that rose to CIT, those officers didn't. They immediately went in, challenged the individual, and the outcome was very tragic. Officer Miracle does everything right. He has a view of him. He's got a good distance, making sure no one else, citizens maybe interact with him, waiting for backup, and that's what happens. Backup arrives, Officer Miracle interacts with him very respectfully, shows him empathy, everything we teach, gets him help. When he was filling out the paperwork, Johnny makes this statement to him. He said he thought about charging toward Officer Miracle in hopes of being shot. So I show you that because if Officer Miracle decided to interact with him by himself, it could have been very tragic. So slowing down the situation is really the most important part of CIT. If there's no rush, if there's no immediacy, wait until you get more people there, assess the situation thoroughly, and then make a judgment. And that's exactly what he did, and it really ended up, I think, well. Johnny got help. No one was injured. There was no use of force. It was a really good outcome. So I've already talked about perspective. So I think a lot of times, I know we kind of alluded to this the last session about perspective, the guardian versus warrior mentality. And I think a lot of times we see when we think of law enforcement, unfortunately, this is the perspective we think of. This stems a lot from Ferguson and some of the incidents that happened in our history, and a lot of times this is what people think of. This is an officer, obviously, with a young man. The opposite end of the spectrum, what CIT is all about. He's posing for a picture, and in good community policing. So I think what the biggest issue is how do we weigh those two? Certainly, there's a time and place for that first photo, an active shooter situation. But I think a lot of times there can be both. So kind of building that perspective is really important. So I'll just read this. The Guardian mindset emphasizes communication over commands, cooperation over compliance, and legitimacy over authority. In a use of force context, the Guardian emphasizes patience and restraint over control, stability over actions. If we go back to the Officer Miracle situation, that's exactly what happened. He was calm, patient, let time be a good factor for him, and it ended up really well. So the President Obama's report on 21st century policing actually says law enforcement agencies need to shift from a warrior to a guardian culture of policing. So that's in that report as well. So as I mentioned earlier, CIT is a best practice. CIT has been utilized in many law enforcement agencies worldwide, is considered a best practice model in law enforcement. OPATA, which you all learned about, who mandates training for officers. So when I came on in 1995, I got 12 hours of mental health training. That was it. So as you see, as we've evolved, in January of 2016, it was raised to 20 hours. Like I said, before that had been 16 hours. CPD, we've gone farther, much farther than this by requiring the 40-hour CIT course for all officers now after they complete their FTO period. So we've really, the chief and the administration have decided this is a really important concept. We need to best train our officers the best we can, and that the 40 hours on addition to that 20 is really critical. Another reason why CIT, why have it? So you'll see here, unfortunately, all the departments represented here were under a DOJ consent decree. And if you read every one of these, there's a huge component in each how they dealt with the mentally ill. Every single one of them, there was a high component of they did not effectively interact with mentally ill. They used force too much. They didn't de-escalate. They didn't have resources. So this is a big indicator why we in CPD take this very seriously and continue to build on CIT. So as I mentioned, the President Obama's 21st century policing, today's line officers and leaders must be trained and capable of addressing a wide variety of challenges, including international terrorism, evolving technologies, rising immigration, changing laws, new cultural mores, and the growing mental health crisis. So in the report, we recognize this, like I said, 18,000 calls for service is a lot. So it's only increasing, so we need to be well equipped to handle not only mental health situations, but all situations. So Pillar 5, if you've read the report, is just about training education, and it states, incorporate the following in basic recruit and in-service training, crisis intervention teams, mental health, and diseases of addiction. So we have done that. We have obviously the CIT, but we're also adding components of addiction, understand addiction. We want officers to understand why this person might be addicted instead of, them, maybe not having all the knowledge they need to have. So it's really important we provide that information to them. The One Mind campaign, the International Association of Chiefs of Police came up with this idea basically to ensure successful interactions between police officers and persons affected by mental illness. The initiative focuses on unified local communities, public safety organizations, and mental health organizations so that three become of one mind. Currently, 419 agencies have signed on to this, including CPD. It has 4 components. One is develop and implement a written policy addressing law enforcement response to persons affected by mental illness, which I showed you CPD does have. Establish a clearly defined and sustainable relationship with at least one community mental health organization. We've developed relationships with dozens, as I showed you in the slide. Demonstrate that 100% of sworn officers and selected non-sworn staff, such as dispatchers, are trained and certified in mental health first aid. That was one thing we kind of examined. Mental health first aid is an 8-hour course, and it's really basic. It would be for someone that really had never probably heard about mental illness. So I actually became a trainer in that, and we did look at it. We realized that we were doing so much more already. And on top of that, that we petitioned the IACP that, provided them what we were already doing, and they said we surpassed that 8-hour mental health first aid, so we met that as well. And lastly, demonstrate that 20% of sworn officers are trained and certified on the crisis intervention team. We're at over 20% right now, and as we project, we'll probably be at over 50% by 2020. So we're surpassed that as well. So as I mentioned earlier, the first slide, there's CIT, and then what we've done is we've really enhanced it. We've made it better, and we've developed some programs that are cutting edge, in my opinion. One is our mobile crisis response pilot. Basically, this is a partnership with the Franklin County Adam Board, NetCare, and CPD. So we basically have an officer, a CIT officer, in a cruiser with a mental health clinician 7 days a week from 2 p.m. to 12 a.m. And they're taking calls for service, real time. And they also do follow-ups, which is one thing that I think we really do a good job in the moment responding to these calls for service. one thing we weren't so good at was what happens a day later. We might take that person to the hospital, so to avoid maybe having to go back when that person's back in crisis, let's make sure they're doing okay. Are they on their medication? Have they seen their doctor? This team does that. They're able to take the time that a lot of patrol officers don't have and do those follow-ups. And I think it's been really, so the pilot started in June of this year, and as of October 1st, they've been on over 1,600 calls for service. And there's only 4 teams, so I think it's been really beneficial. The pilot ends in December, so I'm hoping that it becomes a full-time team. I think it'd be a real benefit to the community. And this is just kind of shows that follow-up, how important it is. It's just a study that said if you can do case management with someone, there's a 50% reduction for rearrest or, if we have to go back. So that case management's really critical. That's what that clinician provides, not only, the expertise and the education, but they also have access to records. So obviously, we're very HIPAA compliant, but they can provide the officer with the basic information that officer needs to know in the moment about that client. So it's really been a really big change culturally in what we do, but I think it's been really important. So the Rapid Response Emergency Addiction and Crisis Teams, it's a mouthful, REACT is what we call it. This is a collaboration with Columbus Fire and CPD. So Monday through Friday, from 4 p.m. to 9 p.m., we have a CPD, CIT officer go out with a Columbus firefighter. And what they do is they go do overdose follow-ups. So a lot of times the cycle with an overdose, that person overdoses, they may or may not go to the hospital, usually go AMA very quickly, or they don't even go to the hospital. What this team does is they're able to collaborate with CPD records and CFD records, bring those together to find folks and go meet them where they're at. If you've ever seen anyone who's, during a Narcan deployment, they're not ready a lot of times to get help. So this is a great opportunity for that officer and the firefighter to go out a couple days later, talk to them, what do you need, what can we do to help you enter treatment? And we're very fortunate, as you all know, in Franklin County to have the Maryhaven Addiction Stabilization Center. They can literally take that person immediately, get help in the moment, which a lot of times before January, we didn't have that ability. So it's really a great team. It's been very successful. They're also helping out the family members. They'll call family members, maybe they need some help with some bills or, a wide variety of things while that person's in treatment. They assist them with social workers, trying to get them the help they need as well. So it's really a community effort all around. So our naloxone program started as a pilot in 2016 when really in Franklin County, we realized that this was a huge problem. Columbus Fire and Columbus Police got together and said, statistically, when fire responds, it's about a 4 to 6 minute response from firehouse to the call. Our officers can get there within 90 seconds a lot of times because they're already out. It makes sense. They're already out on the street, so they can get there much quicker. So with Columbus Fire and Columbus Police, a pilot was launched where 2 zip codes, or 2 precincts basically, 13 precincts, which is the south side, 19, which is the Hilltop, for the pilot. And they trained those officers, gave them Narcan, and had them deployed. And it was hugely successful. So the chief decided to make that a full-time program, which it did become. So in 2016, there were 61 deployments of Narcan. 2017, there's 281. And to date, we've had 388 this year. So as you can see, the problem is not going away. What we've done is we've really equipped officers, though, with a life-saving drug. And, there was some cultural, there was a little bit of, at first, some pushback. Anything new, anything culturally changes. I had an officer, we trained her. She said, "Lieutenant, I don't agree with this." I said, "Well," and that time it was voluntary. So she was a CIT officer, so we trained her. 2 days later, she deployed it. So it's really difficult to be in the moment and having someone suffering an overdose and not helping them. I think just about every officer I know is going to help them. So this gives them the ability to do that. It's been hugely successful. The city's been phenomenal with providing me funding because I buy all the Narcan and continually get the officers trained. So it's been a huge benefit for the city and the community. And we have over 600 officers trained now. So virtually, if we have 917 officers in patrol, you can do the numbers. Our goal is to get 100% trained. So we're well on our way to accomplishing that. So the AED program, interestingly, kind of stemmed out of the Narcan program. We worked with Columbus Fire, And a lot of times when you're going on these calls for service, there's a cardiac issue or they might need, that kind of help. So with Assistant Chief Jim Davis, who's left CFD, kind of got with our leadership and decided that why not have AEDs in the field? Put them in some cruisers, have them go out on these calls for service as well. So right now we have about 28 of those deployed, and so the officers are all over the city. They have them, the call comes in, all 911 calls come in, originate with Columbus Police. If that call taker kind of deems that that might be a cardiac issue, they'll alert that patrol zone, and that patrol dispatcher will then say, does anyone on the zone have an AED? So another thing we're doing really to try to help folks out in the field, so it's been really successful. Like I said, the average CFD response time is 4 to 6 minutes. And our priority one is what we've made these is 90 seconds for us. So you can see that time is of the essence. So a lot of times this is really critical. And basically, studies show that law enforcement agencies with AED programs have a save rate for cardiac arrests above 50%. It's still very new, so our officers, and it's still a cultural change, so they're still getting used to it, but I think it's going to reap big benefits for us. So lastly, this is a picture that hangs in our academy, and you've heard me talk about all these different programs, what officers are carrying. This goes back, I think, to the 50s, and you see all the equipment. This was an ambulance cruiser, and you see all the gear that's out there. Really what we've done, we've become full circle back to that kind of concept, right? If we're really serious about helping the community, then why not provide the tools that officers can use to save lives? And that's kind of what our focus has been, to take CIT and really expand it into these other programs. And since we've been here, we've had 4 mental health runs. That's about what we average. So once again, you think about that, it's a lot of runs. So officers are going to them all the time. They're complicated. A lot of resources are needed. So just to kind of keep that in your mind that, these are very prevalent calls for service. So with that, that concludes my presentation. I'm happy to answer any questions.
Thank you. And I'm actually going to start with a couple
Yes, ma'am.
today. You say 18,000 runs in, was it 2017?
Yes, ma'am.
How many of those were juveniles?
I have that number. I can get you that. I want to say, I don't want to give you an exact number. It's probably about 10%, maybe. I'd have to get the exact number.
I mean, I'd like to get it if it was only 10%. That'd be surprising.
Let me
in light of
get
what I'm
that. I
just
don't want to
kind of
misspeak,
hearing.
but yeah. I'll
Then
get
sort of my follow-up question would be, I know that Nationwide Children's Hospital is building a brand-new hospital.
Yes, ma'am.
Over 200 beds for youth with mental health issues. Has the department or your department already started working with them around protocols?
Yes, ma'am. So we actually, I'm on a grant right now where we're trying to prevent taking kids to the hospital, right? And I think the real goal for all of us is we don't want to take people to the hospital if they don't need it. So one of the things we're kind of throwing around is having, when a person would call in a juvenile, Nationwide Children's has a crisis hotline that's staffed by clinicians. Why not three-way that call, get the parent or whomever calling in to say, hey, this is what I'm experiencing. Maybe they can be linked to services without having 2 officers come and remove their child. So sometimes that's the reality. So we're on several projects with them. They're also thinking about doing a mobile crisis. We're working with them. So that'd be great. I mean, I think, like I said, kids' situations are really complicated, and the providers are far different than adults. You're really limited if you, so in Franklin County, if you're 14 years or younger, you go to Nationwide Children's. If you're 15, you go to Ohio State, which I'm not an expert, but I don't get it. I don't know why you would take I've been to children's hospitals, psychiatric, and to put a 15-year-old there, I don't know. It seems to me very traumatizing, but that was the agreement between Nationwide Children's and Ohio State. So yes, to answer your question, we're trying to explore a lot of different programs with children's.
And you mentioned the 21st Century Policing Report. I'm about 2/3 through it, but I do think that I would have come across the recommendation around CIT training. Am I recalling it correctly that it would recommend that all officers are trained?
I believe that is the recommendation. So I'll get on my personal bandwagon here. If you look at CIT's model, they want volunteers. There's a lot of different philosophies. To go on these runs, obviously any officer can go on these, but to get someone who wants to volunteer to go on these, you're really getting a little bit of passion. And a lot of times when you talk to officers, they have someone in their family. There's some inner meaning that they want to go on these and help people more. So, yeah.
But it's not volunteer for the new recruits, right?
Correct.
That's
true.
mandatory.
That's true.
Okay.
Well, and then, so they'll be, yes, CIT trained, but yeah, we still will offer classes for officers that have been on, so that's not going to go away. There'll still be the ability for officers that want to, enter that as well.
Okay, thank you. Other questions? Reggie?
Lieutenant, thanks for the presentation.
Yes, sir.
A couple questions. One is a follow-up to the chair's question about training. You have a goal to train all of your officers here in the CPD. In CIT, is that the 40-hour training or a hybrid of it? Because
No,
a lot of police departments are not doing 40 hours. They're not getting the NAMI recommended version of that. Are you looking at doing the 40-hour version of it?
So yes, sir. So what we did several classes ago, we took the 40 hours and we tried to put it in the academy setting, and it didn't work so well, mainly because they couldn't do the case manager ride-along because they're not sworn yet, and if we put them out in the field and something happened, so they were missing that valuable component. So what we've done now is let them come back after the FTO period, which is also huge because now they've developed some perspective. They've been out.
Field training officers.
Correct,
so-
yes, sir. So they've been out in the street, they've seen folks in crisis, they come back, they do the 40 hours, now they kind of get it more. They've seen folks, some people, if you've never seen someone in crisis, it's hard for me to sit here and kind of try to paint that picture for you. They've seen it now, they'll come back, and they'll get the full 40-hour training.
In one of your slides, you said that with case management, 50%, there could be a potential 50% reduction in risk for rearrest for persons with mental health challenges. But we know far too many people are ending up in jail and prison without the crisis intervention of net care and what have you. So are there, a couple questions with that. One, are you working with Hamilton County Juvenile Detention and Hamilton County Sheriff's Office to follow up with those persons that you arrest here in Columbus to ensure that they understand that this person may have a mental health challenge, can you, I guess it's kind of a question of how to extend what the work that you're doing to those resources that might need to know what you're doing so that they can follow up. Some of these people don't even need to be in jail in the first place. If we did the right kind of intervention, they wouldn't even get arrested. So this question of risk for rearrest, it should be, I think it's kind of worded almost there's going to be a presumption of arrest when there should be treatment in lieu of arrest in some cases. So how are you interacting with at least Franklin County Jail and Franklin County Juvenile Detention with the persons that you detain?
Yeah, so we recently did I forget the name of it, it was a mapping exercise where we brought in everyone in the county, all law enforcement, various providers to kind of look at Franklin County, the big picture. And I think everyone would agree that the case management piece is critical because, like I said, officers go on a call, do a pretty good job in the moment. That person goes to net care, goes to OSU, what have you, goes to jail maybe. What happens next? I think what's really important about, say, the full-time team, they have the ability to do that assessment. It's hard for a patrol officer, they could do it I'm going to go back a couple days later and see how Johnny's doing. But if we build in that already when we do that case management with the county, so we're already on a team, the county is actually standing up a full-time team. They already started, they're going to have a couple deputies. The issue with that is they're probably going to be saddled with probates. So probates are another issue. I think in 2017 there were over 2,000 filed in Franklin County, and I think over 1,000 were actually probated. So the county is the entity that serves those most likely, so they built this team, but I think a lot of that now is still going to be probates. So to answer your question, I think that case management piece is critical. And who does that? Like I said, I try to do it when I can, but usually it's when a situation is brought to my attention. I'd like to look at every mental health run every day, kind of do that triage, if you will. What did we do? Did we do it correctly? Should we have taken them there? Should we not? But we are lacking that.
Presume parole and probation are included in your
We have, and we've just added parole officers to the CIT training. So it's really about building relationships. And some people say, well, why are you having non-law enforcement in your training? I look at it, we have OSU Medical Center in our training, we have Riverside Security. We're all part of the big puzzle, if you will. And if we're taking folks to OSU Medical Center or Riverside, why wouldn't we want their security officers to have the same training as the officers do? So really, it's about that relationship, and that's what I've tried to achieve through CIT. I've tried to expand it, not just law enforcement, which is critical, but all the other partners. Capital University goes through, Columbus State, the universities, Ohio State. So we've really tried to build that relationship and then try to then branch out if we will. So
I would note too, as part of the booking procedure at the county jail, there is a intake procedure where there's a medical assessment that includes mental health.
Thank you.
yes, sir.
I'm sorry, Andrea.
You talk favorably about the Mobile Crisis Response Unit and how you'd like to see that continue. It's a pilot now, so it's a 6-month pilot from what you described. What are the outcomes that are being looked at in order to make that a permanent program?
We're really looking at if we interact with someone, are we going back out, basically? So we try to look at so with 4 teams, so I said they've had 1,600 interactions since June. We've had 18,000 runs. So I think some people think, well, if we do this team, well, that's not the reality. The runs will probably, stay pretty steady. The goal, though, is to find someone they have interacted with and then that follow-up piece so they don't, they are, become med compliant, or it's not uncommon for the mobile crisis team to say, hey, when's your next appointment? And they'll say, I have an appointment Thursday, and they'll go Thursday, did you go to your appointment? No, I missed it. Well, then that social worker literally calls that provider and tries to help them reschedule an appointment. So I think that's where the success will be. And then obviously, we've dealt with some high-profile situations. In fact, we had a city employee who expressed some violence in the workplace tendencies. So I was contacted. We were able to get the team immediately to interact with that person. They were probated, and there was no workplace violence. So I think sometimes we're kind of, just based on limited numbers with the 4 teams, we have a very limited scope. So we're trying to, the individuals we do come in contact with, always do a follow-up, and then the higher profile. When we had the Parkland shooting situation a while back, I think, and Chief, I think in that 2-week period, there were like 100 threats in some of the schools. So our team kind of got involved in that, and we tried to vet some that we thought were potentially serious, and we tried to get the team involved with them immediately to try to interact and prevent, a really bad outcome. So I think numbers are going to come into play with, 4 teams if that were to become full-time. But I think we could probably be more effective once we understand how the team, once we can get more data. Like I said, we've only been doing it since June. So NetCare is obviously doing their own data piece. We have an individual at Ohio State. He's working on a thesis. He's going to look at our project too and provide some assessment at the end. So
Just a follow-up to that. So when they're doing the follow-up run to the individual, where is that information documented specific to that individual, or what provider gets that information to maybe assist that individual?
So we, CPD, we do our own reporting. So what's important, and we're not trying to circumvent HIPAA or anything, but a lot of times an officer can ascertain some good information. And some of this isn't even medical. It's who's a guardian contact. Who can we call at 3 in the morning to get this person help, or to maybe triggers? What in the past has triggered them? What has been effective in de-escalating them? We try to document that in our reporting system. So any officer sees that, not just the team. NetCare is doing their own case management, and they're sharing that appropriately. If they're linked, say, with Southeast Mental Health, there's a constant conversation back and forth between that clinician from NetCare and the provider at Southeast Mental Health. So we're trying to be careful, be respectful of privacy, obviously, but obviously from the CPD side, we're documenting stuff more for safety and what's effective strategies to help this person down the road if another officer goes that has no experience with this person whatsoever.
Thank you.
Welcome.
Before I call on Vlad, I have a tendency to only look in this direction, so I want to make sure that I'm not missing. Have there any hands been raised?
Yeah, there's
Already there?
a couple, yeah.
All right, so I'll start with Olitha. I'm going to get back to you. We've got plenty of time, okay? Olitha?
I don't mind yielding to Vlad. I can wait.
He does it every time to me. Glad he's yielded to you.
Thank you for the presentation. I have a quick question. You said that the crisis, mobile crisis pilot is 2 to midnight and the React is 4 to 9. So is that because that's when most of the calls are, or that's when the best time to follow up?
Yes, sir. So yeah, that's just peak calls for service happen between those hours. So the mobile crisis, or I'm getting my acronyms mixed up, the REACT team, the officer, I applied for a grant to the Ohio Attorney General's office. That's how that's funded. So we had to kind of work with Columbus Fire to, work hours out and stuff like that for overtime, because they're paying, I believe, just straight overtime. So we kind of had to work with them on optimal hours. But that really, those are the hours that are peak for these type of calls for service. That's why we chose those. If it were to become a full-time program, obviously, we would look at, I think we need to expand those hours, because obviously, it's not a 2 to 12. And these happen every day, every hour, so we would want to maybe flex their hours a little bit or something like that, so we'd have that coverage.
If I could ask a quick follow-up. I guess it seems like the calls for service may not be also the best times for doing the follow-ups, right? So I'm curious whether the design of the time is mostly based on when the service calls are, or when, again, if the goal is to do the follow-up based on when you think the follow-ups are most likely to happen, when people are at home and things like that.
Yeah, it was mainly based on calls for service, but so at 2 o'clock from 5, we still have the ability, so a lot of times they'll come in service and they'll immediately do follow-ups. I mean, there may be runs holding, but they may, if they have to do follow-ups, because a lot of these providers close at 5 o'clock, Monday through Friday, so they use that 2 to 5 time as an optimal time to reach out to providers, the court system, what have you. So we did build in a little time during, more business hours to provide that opportunity for them.
So kind of a follow-up on Mr. Wilkinson's question. How do you, and excuse me if I missed this portion, but how do you identify how a call is characterized or identified? Does the dispatcher do that? And then if so, how are they trained? Do they also receive the same CIT training into the 60-hour extent that you spoke to earlier?
So yeah, you're correct, sir. So the call comes in, and a 10 code is what we call them. So we have 110 codes. And that's a tough job when you're that call taker. As you listen to that one call, they have a very small window to characterize that call. Sometimes if I call in and say, my son's mentally ill, then they know right away it's called a 16B is what we call that code. A lot of times, though, unfortunately, we have to do what we call like an unknown complaint, like a 34. And those are the ones that I think are really dangerous, not only because we just don't know. And sometimes that's just because, like the call that we heard, that was a 47A, that's a suicide attempt. He had said he cut himself. That cues the call taker right away. He tried to commit suicide. He said he did it intentionally, so that's a little easier to make. They do receive 8 hours of training, sir. I'd like to get them into the full 40 hours, but we've had 10 classes in 2000. We will have had 2 classes this year. Every single one's over capacity, every one. And just to let you know, the CIT program is a county concept. So we'll have CPDE officers there. We'll have county deputies. We'll have Worthington Police, OSU Police, what have you. Since we're in partnership with the Adam Board, they want to make it a county concept. So we are. And it makes sense, right? We're dealing with folks, we may be adjoining jurisdictions. We want them to have the same level of training that our officers do. So if they do go on runs together, they can talk the same language. So that's kind of but I'd love to get every dispatcher into the 40-hour. I just don't see it being feasible.
Excellent. And so that is kind of why I tied that to Mr. Wilkinson's question, because my question then becomes, how often, or are we tracking how often these calls are misidentified, that a person who has a mental illness is actually treated as a person who doesn't? And so then that goes back to a comment that was made last week by Commissioner Alsada, that her brother suffered from mental illness. And I believe it was incorrectly characterized as an exaggeration for this reason, because before there was a place where you could say that I was abused by the police, or that there was a such thing as police abuse, this thing was institutional. And so then I wonder about, when we talk about, you mentioned our history and perspective. So the history of the African American community is going to be different in the context of the entire history of the country versus the history that the law enforcement professional may bring to the situation. So I wonder about how do we teach empathy and perspective in light of the implicit biases that we all bring to the table in light of our life experience. So you have a whole life that you've lived, and then you come in and we have to try to place ourselves in the shoes of a person empathetically and have a different perspective. So I'm interested in how CIT addresses that.
Well, it's really the panels. Like I mentioned, we do the cultural panel, and Dr. Kevin Dixon with Adam, he facilitates that panel. He talks about the African-American perspective for mental health. And I look at the CIT training, I try to make it mental health. And I get other issues creep in, but I try to make it about, you're getting called to a mental health run, how do we help that person? And I certainly, if that person, there's cultural differences, one of the officers understand, the Somali community, they a lot of times don't want to talk about it. It's a lot of stigma still in that culture, so they may not call the police. So we want to teach that. But yeah, I mean, we do that cultural panel, the family panel, and we bring in a panel of folks with mental illness. And they come from all different walks of life and races. So what we do is we break them out into small groups so the officers can ask any question they want. That person can also say what's worked well with the police, what hasn't worked well. We want the negative too, right? I don't want it to be rose-colored glasses and everything's perfect. We know it's not. So what can having the police interact with you before in a mental health setting, what did they do right, what did they do wrong, what do you expect? And that, from the parents, that's really key because they're calling us at the worst moment maybe in their life. The last thing I think a lot of people want to do is have the police in their home interacting with their child. So we want them to tell the officers kind of what they expect, and you know what I mean? So I think that's the best way I can answer the question is providing that cultural piece and the different panels. I think that's what makes CIT a little unique. It's not me standing up there doing a bunch of PowerPoints. We're bringing in experts in the community, and people have lived experiences that can really tell them what's going on out in the community.
Excellent. So let me back up first of all and say thank you for your presentation, because I know that's a tough space to be in, and being on the hot seat to come up with responses to our questions. But my last question then is officer feedback. How do you do officer feedback individuals who have come through CIT training and then they've deployed it in the community, these skills and abilities or whatever, and then how do you gauge what they feel like is effective and what they feel needs to be changed?
I will be 100% honest with you. That is a deficiency in my program. And also the advanced bringing the CIT officers back. My boss is in the room. He's been telling me to do this, and I'm trying. I don't want to bring officers back and give them filler type stuff. I want it to be something that's affecting them. So I do put out surveys occasionally, or some issue comes up. I have a CIT distribution list. I'll ask, is anyone experiencing this? We have an intranet page where there's a call, like a forum where they can talk. So I try to look at things that I think will help them. Today, actually, at the academy, there's an autism class going on, so that was something that was offered to them. So yeah, that is a deficiency. I need to do a better job getting feedback both ways, you know what I mean? So that's something I hope to aspire better to.
Well, I appreciate your transparency. And then something that we'll make these suggestions, but maybe they would be good trainers in the future to come in and just talk about real world scenarios and how.
Yeah, it's open if anyone would like to come, certainly. My neighbor, his son has Asperger's, and my youngest son grew up with him his whole life, and I asked him to be on the panel, and he agreed. So I'm always looking for, some new faces and stuff like that, because I think, we want the perspective. We don't become stale, bring the same people in every month to tell the same story, because we want, a good perspective, yeah. But
Yeah, I'm talking about specifically your officers who you've trained and then who have gone to the field and actually used the training.
Oh, I got you.
Actually
Okay.
coming back in and expressing.
we do that sometimes, actually, yeah. We'll use, in
Good.
fact, one officer does our PTSD course.
Okay.
He's come back, and he does a lot with vets, a lot of work with vets. So he does come back and does a class. It's really good.
Good, and there's a lot of research about how PTSD is extremely high in minority communities. So I noticed that in your presentation, you listed veterans, but inner city children show the highest levels of PTSD here in the United States, in fact, even higher than in third world countries or even on the West Bank in Israel. So that would be some interesting, I think, information to provide to your staff.
Yes, sir. I appreciate that.
Thank you. I think it's No, you didn't have your hand up, but maybe it was faster. Good to see you.
Just a quick question. I don't know if you have the information or if it was presented earlier, but I was just wondering, is there any data or statistics over the last 2 or 3 years involving officer-involved shootings and whether or not the officer had CIT training or not? Are there any statistics on that?
Not that I'm aware of. We talk, so when Dr. Kuker from NetCare comes and talks about probates, he does talk about some of those situations, and he has a few studies, but I would have to check with him to see if anything's been broken down to the CIT level. That's a great question. I don't have that readily available.
I think that would be something good for you guys to consider, and maybe if we could at some point see those numbers, I think that would be good.
Yeah, I'll look in that, sir. Yes, sir.
Yes.
Thank you. I'm so close. it's
Well,
hard
but
to
again,
see, right?
have I missed either? And if you, okay, all right.
I think this has been great conversation, and I'm trying to make connections, but, so I have 2 questions. The first question is related to trauma and the relationship between trauma and mental health diagnosis, particularly when it comes to communities of color and that trauma being represented by law enforcement. And so if it is an undiagnosed run, but that trauma triggers the limbic system, which is the fight or flight system in the brain, is there any training for those officers to say, this situation is escalating, I do need to call in backup from a CIT professional or officer who can help me on this particular call before it becomes something? Even though it didn't start as a CIT run, it escalated into one because that trauma took it there.
Well, yes, sir. So a lot of these, like I think Mr. Wall alluded to, don't come in as what we call a true mental health run. So an officer gets there and they assess it. Certainly, a lot of times they'll say, hey, I'd like a CIT officer here. So that's always our goal. So yeah, and the trauma piece, I'm thinking back to our presentations. When Nationwide Children's comes in, we have clinicians come in and provide on the youth. We do talk a lot about trauma, how it can impact, and that child that you sometimes have to, that has to be in your mind too when you're, there's mental health maybe not, but why are we there? Really, at the end of the day, it's like, how do we get that person help? And it doesn't really matter. We don't spend a lot of time on diagnoses because honestly, schizophrenia, it gets very convoluted for an officer. Really, why are we here? And this person's in crisis, regardless of what it's for. It might not even be mental health. It could be trauma or, a lot of things. How do we slow down, get that person the help they need? And that can be in a variety of ways. That's really the goal at the end of the day.
And then the second question was, there was 18,000, you said annually about?
It was for 2017, yes, sir.
2017, 18,000 mental health runs, 50% ended in the transport.
Approximately 50%.
Approximately 50%. Is there any way to disaggregate those runs versus transports by age, gender, race, et cetera, to see who's actually being transported and who's receiving services in place?
I do have that number. I can get that. We did break that down for the pilot I was talking about, Nationwide Children's. I have that number. I can certainly get that to you.
Thanks.
I'd like to ask a follow-up question because it just seems that I've heard so many times in Columbus that we don't have enough services. So have you encountered that? I know I saw 30 partners, but are you running into, you have someone, you've made the decision they needed to be transported to get help, not transported to the jail, and yet there was no one to serve?
You mean there wasn't a place to take them?
You couldn't find a place to take them.
Yeah, and one of the frustrating things is a lot of times, and I'm not a doctor and I don't pretend to be, but we'll pink slip someone, we'll take them to a hospital and they're out in an hour. That's a decision made by the clinician or whomever, and that gets frustrating sometimes because then we're back to the house the next day. So I think it just really illustrates the big system. And I don't want to say it's broken, I think it's fractured. I think we have really great resources in Franklin County, and I think people really do their best, but just due to volume and capacity, that's where our problem is. I think we just don't have the beds. Now, I think with Children's opening up the new pavilion, that's going to really be huge, but I'm already hearing folks from out of county here. That place will be full very quickly. Unfortunately, that's just the state of where we're at, but I think it's a great step in the right direction.
Any other questions from commissioners? Thank you so much again for coming back to us
My pleasure.
for a second time and for your presentation. It was really very helpful. Thank you.
there's any follow-ups for training. I know I'm not on speaker or on mic, but if there's
Okay.
any follow-ups for any training, they are here if there's follow-up from last week.
So to the commissioners, going back to our last meeting, and there were lots of questions about training. One of them I think was answered. You wanted to see truly the breakdown of CPD's training versus, I guess it's OPADA's. And so that was sent out to you. But are there any other questions that come to mind around training? Thank you, thank you. We're a little bit, I think, ahead of schedule, but so should we go ahead and we'll take a 15-minute break. And so maybe commissioners who didn't get a chance to grab lunch, water, or a cookie or something, you can, but we'll take a 15-minute break, and then we'll come back and we'll have the presentation by Matrix. And I'm going to turn the mic over to Mr. Clark.
Thank you, everyone. So before we get into the matrix portion of the agenda here, just want to make sure that the commissioners were aware of a press conference here at City Hall this morning, where a group of local faith leaders came in to express their concerns about police community relations and relations primarily for African American officers in CPD. Wanted to be sure to share the mayor and Director Pettis's perspective on this and begin by saying thank you to, I think, a couple of at least one member of the clergy has joined us here this afternoon. We share the values that they brought to the table with these issues. And I think we can all agree that we want safety for our families, for our neighborhoods, and for our first responders. I think it's fitting that at this meeting we'll hear from Matrix for the first time, and we're having a meeting of this body, which is one of the most important pieces of the mayor's comprehensive neighborhood safety strategy. So just want to make sure that you're aware of that. You'll probably see it in the evening news this evening, and we'll be able to get more information about their concerns online.
Thank you, Brian. And I would share this. I have shared in some of those small meetings with Brian and Elon, almost from the very beginning, that one of the things that I wanted to make sure happened during this process and with Matrix, that they ensure that there would be a way that they could capture input from our minority African American police officers, and that it be done in such a way that they felt comfortable and secure in sharing whatever their personal concerns are. And I have been assured that there is going to be a way that that can be done so that we can have that input. I think Columbus may be one of, well, I don't know the numbers. In reading the 21st century policing report, there were several references to African American police unions across the country. And at one point in this city, we had one, but it is my understanding that it has essentially been defunct for a number of years. And just from my time of serving on the bench, serving as the Columbus City Attorney, and just my interaction with African American officers, sometimes they feel that they are voiceless in this entire process. And so I would like to extend my thank you to the clergy for coming forward, but also to the mayor and Director Pettis, and so quickly responding.
So before I introduce the members of the consulting team that are visiting us today, I want to give a quick update on where we've been with this contract. So we had a fantastic kickoff with Richard Brady, who's the president of the company and is the sort of the head for this study. He had an opportunity to meet with the mayor one-on-one, Director Pettis, Chief Jacobs, and all the deputy chiefs, as well as a number of department directors that are directly involved in delivering comprehensive neighborhood safety strategy services and solutions. What was very clear is that we have folks that are open to change, that are thinking strategically, that are thinking forward-thinking, and I think, at least from Richard's perspective back to us, in a way that a lot of other cities are not contemplating police community relations, or public safety generally. So I think great kickoff to this event, to the study. A couple of things that I'll touch on that I think are important, especially for the commission. So part of the final negotiated contract with Matrix was a series of community meetings, actually focus groups is really what they are. So Matrix will be partnering with the commission to run Matrix focus groups in our opportunity neighborhoods and focus on both community members in one set of focus groups and then first responders in the second set of focus groups. I think it's really important to have that neutral third party through a professional facilitator helping us guide that conversation and get the most out of the time we spend with the community. There will also be a community-wide poll that will be sent out. Essentially, it's a traditional polling instrument. It will be statistically valid and will help us understand both what our residents perceive of our police department, but also what they want out of a 21st century police department. And then lastly, there will be a employee survey that will go out to every member of CPD, and there will be a special focus on a couple of affinity groups. So female officers, officers of color, and the different ages of officers, because we know that depending on when you came into the academy, you got different training and may have a different perspective on your role there at CPD. So with that, I'm going to introduce Devon Clunas and Ian Brady. I'm going to ask them to provide a little bit about their background, but I do want to especially highlight Mr. Clunas, who was the first African-American police chief in Canada and was an absolutely transformational chief in the city of Winnipeg. So we're very honored to have you as part of our team.
Well, thank you very much for that introduction. Feel really much like the spotlight's on me now. I don't know if I was going to share all of that, but thank you for sharing that. And certainly, we're very happy to be here. Our president right now is in Italy, so he's in a much better place. I'm not saying that this isn't a great place to be, but thank you for the invitation. We're absolutely thrilled to be here with you. We have a short deck of slides that we'll go through, and I think what we're hoping to get from you really is some feedback. And I know I actually want to take some notes because you probably have certain expectations that you have of this review, and we want to ensure that we're meeting all of your needs. But I'll ask Ian just to get started first.
So, quick introduction to the Matrix Consulting Group. We're a firm, we've actually only been around for a little over 15 years, but the leaders of our firm have been consulting to local governments since 1980. Myself, a little bit more recently than that. Law enforcement is our biggest service area. We've conducted over 350 studies for agencies all around the country and in Ohio. Recently, we've worked with a lot of major departments, Fort Worth, currently working with LAPD, Austin, Texas, Kansas City, San Jose, and a number of others. Our approach to doing these studies, it's not just a straight line, just trying to find the number of positions the department needs, but it's how those resources are allocated, what the mission is of the department and interacting with the community, how it builds partnerships, how operations are managed, and really every aspect of what it means to be a police department. So our approach in doing so, it's fact-based and empirical. We first strive to achieve a foundation of knowledge and understanding of how services are provided, and do that through a lot of on-site time, a lot of input through individual interviews, through meetings, stakeholder input, including input from the community, which we're doing extensively, as we'll talk about as part of the study. Working on implementation strategies, so it's not just writing the report and that's it, but also helping you along the way. We pride ourselves on being adaptive to whatever the needs of the situation are in terms of how we develop recommendations to create more forward-looking policies, program, and partnerships with the community. One recent example of a study we did, Austin, Texas. It was a staffing study. but it was also looking at community policing. And so we made 92 recommendations in that report. Only, I think, 2 or 3 of them had anything to do with staffing. The rest were improving training, improving both in-service training and academy training, changing how they went about recruiting, how they went about policies, procedures. And since then, it's been about a year or 2 since that study, and they've implemented, I think, 80 or 85 of those 90 recommendations. So we try to take a holistic approach to these kinds of studies. So our project team, Richard Brady is the president, who's not here, is 38 plus years of consulting experience.
And myself, as I said, former chief of police in the city of Winnipeg, and just a little bit about the city, because some of you might be wondering, where is the city of Winnipeg? It's in a province in Manitoba, right in the middle of the country, just above North Dakota. I spent 29 years in policing, and when I first started in policing, and again, it's a city of about 750,000, very similar dynamics to your city. But when I started in policing there in 1987, there were not many people in the police service that looked like me. And the reason I became a police officer truly was I wanted people to see people like myself in policing, wanted to build a bridge between the community and policing, because to be honest with you, I was afraid of police officers when I was a young person. Never once thought I would end up as the chief of police, never mind just being promoted once or twice up the ranks. And so when I applied for the position in 2012, the reason I applied to be the chief of police was I thought really as a police service, there's much more that we could do for our community. It's not just about policing the community. It's how do we build a bridge? How do we help to create healthy communities? And so my perspective when I became the chief of police was I started a philosophy of crime prevention through social development. We can't just simply feel that more police officers are going to solve all of our problems. So it was getting the entire community to work together, to say not necessarily that we own the issue as a police service, but we can help be the catalyst to real meaningful change. And I retired in 2016 because at one point I realized that certainly we had arrived at that point. Because when you look at the mission and vision statement of our police service, it spoke to being good at law enforcement, but more importantly, helping to lead crime prevention through social development. And so when I retired, I was given the opportunity to join Matrix because people really appreciated that type of philosophy of policing. So it's not just about the police as an island to themselves or citizens as an island to themselves. The work that we are trying to do, we say we want to be a bridge builder, realizing that community needs police and police needs community. And so that is what my passion is, that is why I'm here, and that is why I continue to work post-policing.
So just real quick, the rest of the team, John Scruggs, he's a manager with the firm. He was a former captain in the Portland Police Bureau, Portland, Oregon. And he's based out of our Raleigh, North Carolina office. Ian Brady, I'm a senior manager with the firm, and I'm based out of our Portland office. I've worked with the firm for over 6 years. I specialize in patrol, data analytics, looking at resource allocation issues in GIS modeling. Byron Pipkin is a senior manager with the firm, been with us almost since actually the firm's inception, with 12 years of consulting experience. He's been on all of our studies for major departments over the past 12 years. And he was a deputy chief in the Sunnyvale, California Public Safety Department. Kyle Mested is a senior consultant with the firm, former administrative division manager in Ramsey County Sheriff's Office in Minnesota. And then Ryan Peterson, who's based out of our Portland office, is a consultant with the firm, and he's a GIS and data analytics specialist. So just a quick overview before Devon's going to go in and talk about the different scope items of this study. Real quick, how we go about conducting the study. So as I said before, extensive input is core to this study to developing an understanding of the police division. And that involves a number of interviews, starting with the leadership, going down to the managers, unit supervisors, and down to the line level, so that we really have a complete view of what the attitudes and perceptions of the department are. We'll also be doing an anonymous online employee survey that'll give all members of the division a chance to give input to the study, and it'll ask topics on a number of issues. Extensive input from the community through both a telephone survey, it says online, but telephone survey is statistically valid random sampling of the community, including oversampling of disadvantaged areas of the community so that we're able to kind of drill down the study results rather than just look at it at a gross picture, but be able to see how individual communities may have disparate views of police relations and other topics relating to law enforcement. And that will be conducted by Gomez Research. And we'll also be doing focus groups. And those will be conducted by RAMA Consulting. So in-depth data collection of the division, and that includes everything from call dispatch records going back a year, multiple years, investigative cases, policies, procedures, really everything that helps tell the story of how the police department operates, or police division rather. We'll also be doing a comparative survey where we're looking at policies, procedures, training, really everything relevant to the scope of the study across other major metropolitan law enforcement agencies to kind of get develop a set of best practices that the department can compare to, areas where the department is excelling, and areas where where the division can strive to. So from there, once we have that context, the understanding of the department, we'll move to developing analysis of staffing needs, community partnerships, internal support systems, policies, training, really everything that the division does. And so that will be built up into a draft final report, which we'll review, collaborate with the city and the police division on reviewing our findings, our assumptions, our analysis. And then from there, we can build to the final report.
So when I think about scope, and I want you to think about this because, as I said, I think we would like some feedback from you at the end of this. So when you think about scope, I think about what ultimately do you want as the outcome of this report? And certainly it won't be just words on paper. How will it help you and the police division and the community as a whole? So here's how we typically plan to try to achieve the proper outcome for you. So we look at our sworn and civilian staffing levels optimum for the needs of the city. You are a growing city, and I think it'll be important to determine are the staffing in place that's required for the future growth of the city. Our deployment of staff optimal given the workloads. We have to look at, certainly you might have the right number of staff, but when you look at the workload, are they deployed appropriately in the right areas? Those are the things that we're looking at. Could new technologies improve service delivery? Certainly, we're in a time of technological advances. But while we implement policy, while we implement new technology, I think we always have to remember at the heart of all of this, we have to remember people are at the heart of it. So you might have all the right technology in place, but if you forget about the people piece of it, I don't think we can lose sight of that. But do we have the current technology so that you can be the most efficient service? Does the organizational structure of the organization support the effective and efficient use of the resources? Certainly that's something we have to look at. You have to look at alignment. First, do you have enough rank structure? And do we have respective units in the right places? Alignment is a critical piece if we want to be efficient in the work that we're doing. Diversity recruitment and approaches. Again, I told you about myself, my personal story, why I became a police officer. And when you look at the cultural dynamics within a city, and yes, we would like to see an organization reflecting the city. So are the right processes in place for that? The right hiring processes, the right onboarding processes, the right internal processes. The community. What are the optimal approaches and programs for community policing? Again, you may have the right number of officers, you may have the right technology, but if people don't have a full understanding of their purpose, their need within the community, do we have the right programs in place? Do we have the right training? Do people have the right mindset of why we have police officers in a community? What mechanisms are in place or should be in place to ensure the accountability of staff in proper police practices? problem-oriented police practices. And again, when we use the word accountability, sometimes people think accountability is a bad word. It is not always a bad word. But when you say accountability are people going out and doing the things that we desire or we need to ensure that we have the right community police relationships? Are levels of proactivity in field and patrol sufficient? What best practices and benchmark efforts should be adopted in the police division to ensure you truly are meeting 21st century policing standards? Policies. Policies are a significant piece of what we do. And again, my mindset is that you could have all the perfect pieces of policy, all the right technology, all of those pieces could be right, but let's not forget again, it's about people and having a sense of purpose, ownership, leadership. But at the same time, you have to ensure that you have the right policies in place. Now, you are an accredited policing division, and that speaks very highly to the level that you're at in terms of policies already. Training. Training is a significant piece. And I can tell you, we've been on the ground already, and I've spent some time within, the training bureau. And I can tell you that significant training is on the way and consistently taking place here. But I can tell you, I've heard from every single leader that no one is complacent. So just because you're doing a good job doesn't mean that we say we're good enough. Everyone has a desire to continue to improve. And the work that we would like to do is just to ensure that, yes, again, best practices are in place and all of the right training is in place within the police division. And transparency. And again, sometimes I can tell you, as a former police leader, I think in the past, police organizations haven't been all that transparent because, it'd always be wanting to protect the information. I can tell you the mindset now is that unless the information is going to jeopardize some type of investigation, why aren't we being open and transparent? And I think that's a bit of culture change that is taking place. And so we just want to ensure that that continues. You speak a little bit now about the project plan.
Yeah, so it's a 20-week study, so it's spaced out over a number of months. It kind of begins with that first phase where we're doing all the interviews, we're doing the employee survey, getting input from the community, developing what we call our descriptive profile, which is kind of like our factual understanding. So from all that, building that foundation from which we can do the analysis. And so then moving forward with doing analysis of staffing and deployment, of policies, procedures, training, recruitment, really everything that's included under the police division's operations. From there, after collaborating on our findings and assumptions, moving to the development of the final report in those last 3 weeks. So yeah, we currently are actually just in that second week of the project. So we've been talking to as many people as we can in the department, just trying to learn about the organization and how it functions on a day-to-day basis.
So I can tell you that for us, at least our mindset coming in, and this is where I said I certainly would like to get some feedback from you, because we foresee that our work needs to be about community safety and well-being. And the only way that you can achieve community safety and well-being is the police and the community together, moving that forward. So again, our desire is that this report, when we're said and done, will be able to be a tool that you can utilize collectively to move forward. And when we speak about community, community is the police and the citizens moving forward together. That is what we're about here. And so now I would certainly like to hear from you, because I said I posed a question, okay, what do you desire to see from this review ultimately? Because we're here to serve you. And so certainly we're here to hear your questions, but ultimately I'd like to hear what some of your desires are for this review.
Commissioners? Mr. Wilkinson? Remember your microphone, please.
Thank you for being here. You've done these great studies in just what was on the board, Austin and Kansas City and elsewhere, Los Angeles. When recommendations are made, what's the track records of the cities who receive the recommendations actually implementing them?
Okay, I can start first, and then I'll turn it over to Ian. Because as I told you, when I took over as the chief of police in the city of Winnipeg, there was a review that was called for in 2013. And the company that was awarded a bid was Matrix Consulting. And I can tell you that when they first arrived in our city, in my police service, people didn't receive them with open arms. But my mindset was this: no, we can learn, and if there are things that we can do better, by all means, we want to hear. And so the final review was presented, and when I looked at all of those recommendations, I can tell you that 90+% immediately I said, I accept. And the 10% that I didn't say yes right away to was simply because I thought, oh, we're doing some of that already, or it's already in motion. So I can tell you, speaking from a personal perspective, that the recommendations were well received.
Yeah, we usually find when we go back and check and read about in articles that are published after the study that usually something around 80–85% of the recommendations we make are implemented. A lot of times we'll make recommendations that have to do with staffing that just aren't achievable financially by the city or county, and oftentimes those, in many cases, need to be met over a set number of years, but something around that order of magnitude.
Great, thank you for the presentation. I have two quick questions. One is on the timeline. I see the final report at the bottom. Is there also going to be like a draft report that we're able to see and offer comments on and maybe ask questions or more information on?
Yes. So the three previous tasks before that, the staffing and deployment, employee programs, and operations management, I would consider the end of that, the draft report, basically.
Okay, great. And then my second question is about the community survey that you'll be doing. I don't know, it sounds like it's going to be some other company doing it, but do you have more information about kind of the mechanics? Is it going to be cell phones, sample, et cetera, so we can get a sense of kind of what's going to be like?
Right. I can't speak for the exact methodology, but I know that it's a scientifically, statistically valid survey that will be done through telephone, which I would assume would include cell phones, but using zip codes as the basis of determining different communities and determining sampling requirements.
But you're able to get that information and to get it back to the commission?
Yes. Yeah, and I definitely would love to see that. Thank you.
I would like to hear more about the social development programs that you created as chief of police in Winnipeg, and then also will some of those recommendations be given or recommended to within your study and all of the research you do here for within the context of this city, will those recommendations as well come as how we can, for best practices, implement more social development from our police force in our city here?
Absolutely, and I never like to just pluck necessarily what I have done and say, okay, here's what someone else needs to do, but I will share with you some of what I did do. And I think the first thing that I did was, again, when I became the police chief, it was quite a custom for our city to be murder capital, crime capital. And as I said, I really didn't feel that more police officers would rectify that. But I also understood the history that the city was just accustomed to, that's how we did policing, and police officers were just accustomed to, that's how we do policing. So it was quite strategic in that the first thing I did was, first I had forums throughout the entire city where anyone who was willing could come and sit and meet and talk with me in a setting like this. And I would ask them, what is it that you want from your police? And not a single person said, more policing. They started talking about things like parenting classes, which really is not the police's responsibility, but I said, okay, we can help you with that. They talked about just a walk-in school bus so their children could feel safe going to school. They talked about fixing up the playgrounds. So things like this that typically people would say, well, that's not the police's responsibility. But we saw how that would impact community. And so I knew now what the citizens wanted from the police. And so the same type of engagements that I had with the citizens, now I went and I had with the police officers. So every single one, 1,900 plus employees, had a chance to meet with me face-to-face like this. And I would ask them, why did you become a police officer? And invariably, every single one would say, we want to help people. Well, do you feel that what we're doing currently is working? No. Well, here's what we're hearing from the citizens. What if we tried this? And all of a sudden, they got this sense of purpose. And they had the sense of fulfillment in doing the job. So that made it very easy. And when I started talking about crime prevention through social development, I said, well, here are all the things that we could do. They're not our responsibilities, but we could be the linkages, and it will actually impact our community, reduce crime, and it won't cost us anything more. And I can tell you the first year, crime dropped 13.9% in our city with no additional police officers. And you start to get in the sense of greater community cohesion because people are now banging on the door saying, we want to be a part of this. And so some of the really good initiatives, like for example, in the past, the way that we dealt with prostitution was that we would go out and do projects against those who were actually quite vulnerable. But it was the people in that unit, once they got the idea of this mindset, who came forward and said, Chief, what if we change the name to counter-exploitation? And rather than targeting the young women who are being exploited, we go after the exploiters and we try to help to get them out of that. So we stopped arresting people who were what people call prostituting. We started to help them get out of that mindset. When it came time to deal with, let's say, gang members, in the past, we had our gang unit that would just go out and arrest gang members. And because of this new vision that was set before them, it was one of their members who came and said, hey, Chief, what if after we had to go and deal with a gang member, the next day we go back to the home and meet with the parents or any other siblings to ensure that other young kids in the home aren't simply following in that footstep. And so there were many initiatives like that that started to occur in our city that weren't my ideas, but it's the sense of crime prevention through social development really took root. And it transformed what we're doing in terms of policing. And I can tell you that some of the most hardcore police officers, even ones who had retired, who policed the old-fashioned way, would come to me and say, we love what you're doing. So those things do definitely work, and that's why I'm still involved in this kind of work.
Thank you.
Is there?
Review the surveys as well as the questions for the focus group prior to them being administered to different groups, just in case there's something that it's not adequately capturing for our community?
Yes, absolutely. Both, both surveys will absolutely be part of that, and as well as the agendas for the focus groups. It'll all be provided to the commission prior to it being administered.
Thank you.
Any hands on this end? Letha?
So, thank you for what you're doing. We're grateful to see you here. My question is, for community members, a lot of times we view our interaction with police, or sometimes it's viewed for community members that our interaction with the police is the end all. But then there's another piece, and that is the judicial system. So from the perspective of the community member, the police, the judge are all the same body. And so my question is, does Matrix have any experience with engaging through interviews or surveys, or has that been considered that the judicial system and that interaction be included in the assessment of how safety is conducted in cities? And if not, could that be something that this place would be potentially the genesis of? Because, as I stated before, for a lot of community members, the judicial system is really the continuation. They're kind of, the gun is one form of enforcement, but then the judge is ultimately the other. So.
I think that's an excellent point. And again, I'm not saying you need to do what I did in my city, but we did exactly that, where I met with the judiciary and we talked about some of these issues. And so it was a concerted, collaborative effort. So everyone was a part of it. And so I don't know if that's been done in the past, but certainly, as I said, I'm making notes, and that's something that we will definitely bring back to President Brady. Yes.
Yeah, the scope of study is really focusing on the police division. I mean, like you're saying, the judicial system is, as much a part of it. The laws, everything that goes into law enforcement, it's all one picture. But in terms of our scope in this study, we're really looking at the police division, the community, and partnerships there.
I would just say, as Letha, as a member of the reviewing team, what you just asked is outside of the purviews of what was presented and then what was negotiated in terms of their contract. And I'm just going to be right up front about that. And what you're talking about, I would say, would be an extensive increase. I'm not talking about money, but just in terms of the scope of what we've talked about. It has only been about the police department, not the prosecutor's office, not the judges, not criminal defense, none of that.
Right, and while I'm sensitive to that, I just wanted to bring that up because when we're talking about police-community relations ultimately and how we improve this process, we have to understand that the view through the lens of the community, this is all one continuum. There's no distinction between the person who arrests you and the person who sentences you. And so, but thank you for that clarification because it's very clear that that would be far and above probably what we've already paid them to do or what we've agreed upon.
And look at, I guess, kind of our mission statement, from the very beginning and the mayor's comments, it just, it was an issue that was not, raised, and it's just beyond the scope.
Absolutely. But moving forward, I think, as we seek to truly mend those relationships, that might be something that we considered as the chief or former chief mentioned, that something that is probably could be listed among best practices or something that was successful in Winnipeg, at least Manitoba.
Thank you. And my questions are quite simple, I think, in that when it comes to your final report, I'm wondering about its ability to speak to the people, in that it's not full of police-laced jargon that the community doesn't understand. It won't be a useful tool for them. And so in that same way, I'm asking about, will the duality of that final report talk about best practices and strategies for implementation on behalf of the police force, and then also things that the community can do as well in response to their relationship to the police force? And then lastly, will it be in multiple languages? Will it be in Spanish and Somali and other Nepali, Bhutanese languages that exist in our community?
To answer the first part of that, while it is an operational review of the police division, certainly community strategies are a part of it, and we'll make recommendations like that deal with steps that both the division and the community can take to further programmatic partnerships and other activities. I'm not sure about the language issue. We weren't contacted about that specifically, but that's something that could be.
Again, that wasn't in the contract. I think that is something, it's a good point, and I think it is something that the city would need to consider as its own best practice going forward. But I'm not going to put these folks on the spot because I think it really comes back to the mayor's office. Okay?
Thank you, Madam Chair.
So once we have it, we can.
Thank you. Can be. Well said.
So I have one more question. Oh, no, okay. I'm sorry.
Thank you.
Thank you.
I think I read on one of your slides that you are going to be looking at recruitment and how that fits within staffing. How deep of a dive are you going to look at the global hiring practices of the department?
When you say global, just in relation to the recruiting piece, because that's something that we've started already, having met with HR, we're, again, looking at best practices for hiring, seeing where people are being selected out of the process, see if there's any implicit, or unintentional bias pieces. So we're definitely looking at that, and again, looking at best practices.
And how the Civil Service Commission fits into that and all of the aspects of the hiring and the testing?
Absolutely. Met them today, and certainly we'll be meeting with them as well.
Okay. Is part of their contract also including them working with the subcommittees from the overall committee? No?
Not specifically.
Okay.
But I have a follow-up. Okay, let's go ahead.
Not specifically working with, I mean, in terms of how often you're going to be meeting, et cetera, but I think there will be an ability if the committee comes up with specific requests. Elon?
Information that maybe they have received in conversations with our certain city departments, we can get that to you.
That would be great. Thank you.
And so I guess my follow-up question to that one was internal recruitment and succession planning for leadership within the department. The TO for the department is very non-diverse, as I may say it. And so what strategies are being taken to internally recruit the leadership within the departments and showing a path towards higher ranks within the division?
I can tell you in my interviews so far over the last 3 days, those discussions have come up. And so we'll wait to see what the recommendations will be coming out of, our analysis. But we certainly have been having those discussions.
Sir, I had another quick follow-up question. When we talk about the focus groups and you have meetings with the community and first responders, is there any plan to include community organizations? Because many of these community organizations were born out of response to existing issues. And many of them are represented here, but I think they may add another perspective when you bring in the community of focus groups to actually speak to the community organizations that are seeking to address some of the issues that we've kind of brought you here to assist us in addressing.
As I said, thank you for that suggestion, and that's exactly the type of feedback that we're looking for. So thank you for that. Certainly we'll have those engagements.
Sorry.
Chief, you mentioned that there probably are already best practices, and through talking with folks, everybody wants to improve on those. Will we have some idea of what CPD is doing now that is really good? That we don't need to spend an extra time on, or where the weak spots are that will need extra attention. Then we hope everybody is into continuous improvement with what they're doing, but those gap areas that lack the kind of attention that probably needs to have is where I think we need to focus most of the energy. So but I really want to know as well, what is going well? What's going on that's excellent? What's going on that we should not worry about anymore?
Go ahead.
I was going to say, that's something that is really what that first phase of the project is about, where we're developing our understanding, the foundation for the analysis, where we're able to, at the end of that, kind of have an idea and issues list of areas that really need a lot more focus on and areas that we really see the department excelling at. But at this specific point, it's a little difficult to say because we're still in second week of the project, and we're just trying to understand how everything operates.
You will.
Unless you know now, you can tell us, but.
Another question.
Just a moment. Sean, and then you, Dr. Jones.
I'll see you, Sean.
Oh, hey. So I'm wondering about how do you go about reconciling the tension between non-police folks making recommendations and referrals to change in police ranks when it comes to them responding to the report and implementing the recommendations as it comes from an outsider. I know how complicated that can be when an outsider is telling an insider how to do their job.
Okay, you've asked a very honest question. I'm going to give you a very honest response. That is part of why I wanted to be involved in consulting, because I do understand our culture in terms of policing, and it can at times be very resistant. But it's resistant sometimes for a purpose. Oftentimes we feel like not a lot of people really understand us, and so I'm saying there needs to be that bridge. Again, in my own situation, when Matrix came in, I was very clear, open, transparent with our people that we want to be the very best that we can be. And so if someone's making a recommendation, let's look at it. Right now, I can tell you that it's not just here in the U.S., in our country too. Policing is going through phenomenal change, this whole police community issue. It's not isolated to any one region. I can tell you in my conversations that I've had so far with members of your police division, there's none of that sense of we don't want somebody else telling us. There's just this desire for excellence. And so if somebody has a recommendation, they're just waiting to take that recommendation. So I think you're in a very good place. I just have to tell you honestly in terms of the type of leaders that I've seen so far in the organization. And so I really have very positive hopes for the outcome of this review. I truly do.
Chief, I think you used the term earlier, even when it maybe was connected to Winnipeg, bridge building. So quite frankly, I think I'm more concerned about our working together towards bridge building in this community, because right now, for many communities, there is a sense of distrust, and I could go on and on and on and all of the negatives. And how do we go about building those bridges and creating those more positive relationships? And I don't necessarily want you to give me a litany now, but as you do this work, that's also a part of it?
Absolutely, that's a part of it. And I can tell you, I have lived this journey. And so that's why I can tell you from what I'm hearing, what I'm seeing, what I'm experiencing, is I'm very optimistic about this. And I can tell you, no matter where people live, they want to have a positive relationship. And sometimes we just need to lead them to that place. And I see really committed people here. I see committed people within the police division. And I think you can, in a very short period of time, get there.
And I apologize to Dr. Jones. I just stepped over your time. Please proceed.
I'll let you go ahead and go.
I know.
I actually have two comment and a question, well, both questions. The first one is pertaining to the focus groups that Aletha brought up. And are you all going to be intentional about including youth populations in examining their thoughts and opinions and just getting their voice? Because I know you said we're going to have a couple of community meetings, but they might not necessarily come out. We'll probably see parents. We'll probably see people who are involved and engaged and, are concerned about this work, but not necessarily the kids. And so I think it's very important that we're intentional about including the youth. And so you may have to reach out to like Columbus City Schools or some of our local schools and actually go inside the school to hold focus groups and make that work. And then the other question, that kind of I have, I don't know if it's a question or comment, but you talked about some of the meetings that you have already had with leadership within the department and within the city, and you said everybody is open. Well, I just want to make sure that you all are mindful that there is a huge segment of the population that may not necessarily agree with that perspective. And so you have to be intentional also in understanding what those layers are and being able to peel back some of those layers and seeing why we're here, because we're all here for a reason. And so, of course, we're going to promote and, leadership is going to say, yeah, we're great, we're wonderful, but understanding that may not necessarily be the same opinion for people within the community. So being intentional also about understanding why that may and where we all can work together to improve that relationship.
You're absolutely 100% on point with all of your comments. In particular, if I talk about the youth issue, absolutely. And again, when I did this myself, we had specific engagements just for youth. So you're absolutely on point. And yes, we're wise enough to be aware that not everyone has that same perspective right now. So thank you for those comments. Yes.
Thank you.
On the youth, Commissioner Carter works for the Franklin County Children's Services, and just indicated that might be another place where you could engage youth in addition to school systems. Any other questions, comments?
I do have one other question quickly. How have you in the past, or have you seen a necessity or a need to manage what the city's contractual obligation to the police department has been relative to your recommendations? Because the FOP has a very strong relationship or contractual obligations relative to the city. And so the question becomes, how have you seen your recommendations either integrated alongside those things, or do they often come into direct conflict with those contracts? How do you manage those or factor those into your recommendations, the city's contractual obligations that they have already to operations relative to policing?
Right. I think our responsibility is to provide the best recommendations, because if we're taking into consideration all of those pieces immediately, we might be missing something. So we provide the best recommendations. If there are now contractual obligations that need to be negotiated to accomplish that, then I think that's incumbent upon the city and the respective stakeholders, because I don't think we can let that be an impediment to our best recommendations. It might simply mean that you have to remove a couple barriers to get there.
Other questions? Then we certainly, I know I speak on behalf of the entire commission to say that we are very much looking forward to working with you in this process over the next, as I look here, it's at least another 18 weeks that we would have left. And to thank you for the presentation. And again, we'll be seeing you in the future. Ilana, is there anything else you have from this?
I would just say if you all have additional thoughts as you kind of been able to digest this a little bit more, feel free to send those to us and we can get those to Matrix Consulting as well. So.
Can I ask the chair a question?
Yes.
Will this presentation be on the website? Will you put that on the website?
On YouTube.
Great.
So this is a question for the chair in that, is there a, it's weird asking you this right here.
Be careful.
No, it's an easy question. Is there a part of the remaining schedule for our meetings for Matrix to come back and give us a progress update on how things are
Yes,
going?
I'm sure there will be.
Okay.
Yes, we'll try to work it with their schedule because they will not, of course, be here in Columbus, every day for the next 18 weeks, but we'll be able to work that
Yeah,
out.
yeah.
And then again, I know that there was a question that was answered around, I think, both the questions for the questionnaires and agendas and questions for the focus groups, and so we'll be receiving those, so the answer is yes.
Okay.
Olitha, were you going to ask something?
No, but I hope I asked that last question delicately, because I know it's sensitive.
Excellent job of asking that question.
That's a serious
No, I
question.
actually saw on the slide, there was a note I thought I saw about the FOP contract, even though they didn't specifically talk about it. So I thought that was an excellent one. So at this point of the agenda is just sort of commission updates. I do know that the hiring committee has a meeting scheduled when?
Next Friday.
Next Friday?
At noon at Children's Services, and I appreciate you hosting that.
Okay. And I'm not sure that I can be there, but I'm going to try to make an attempt to at least get to the first meeting of each of the subcommittees, and we'll see about that. And our next meeting, and again, I'm not, believe me, I want the meetings to be scheduled, and it's not based on my availability. If I'm available, I will come. And so we did exactly the right thing when it came to the hiring committee.
We are scheduled for November 1st from 2 to 5.
From 2 to 5.
Location
And-
to be determined.
Location to be determined, agenda to be determined, and more information. I've alerted this to the commissioners before. Of course, we will not be leading the focus group, meetings. I think the plan is we will be in attendance, but it is absolutely a matrix will be there. And then, and also, if you heard, I think the gentleman said RAMA, that's RAMA. That would be Materian Rights Organization will actually be facilitating. I think those, yeah, he's local. If you haven't met Materian, many of us have worked with him over the years in many, many different ways. But as soon as those dates are determined, even certainly hopefully before November the 1st, or November 1st is right around the corner, we'll get those out to you as soon as we get them, so you can get them on your calendars. Is there anything else?
There are 3 of those, is that right?
No, there's, is it 9? Is it 2 in each?
Yeah, 2 in each district.
Right now, there are 2 in each district, and that
So-
does not
so-
include Dr. Jones's thought around youth, which I think is, and I don't even know if we would be at that one, because we wouldn't want to in any way impede their openness. I mean, it's something I think we would have to discuss, whether having, 17 adults kind of sitting around staring at them, if that's a good thing or not. It may not be. So we'd have to figure that out. But it's 2 meetings in each of the neighborhoods, so 6 meetings total.
I think you said Hilltop and Linden and Southside.
Correct. Those are the 3 neighborhoods.
So if we have interactions with youth in our, because I would, with my work and what I do, I would really like for the voice of the young people that I serve to be heard. And they're not usually in school. And so will we be able to bring,
Well, I would say that we're going to let Elon figure all of that out.
Okay.
And with others, I mean, we've heard several different sources, but he'll work with the commissioners and your thoughts, your volunteering, that you'd like to somehow get some of your youth, in a meeting. And so we'll be able to do that, and then to bring Matrix in, I'm assuming is how this would work.
I want to get your perspective on folks such as youth who should be a part of these discussions. So that's something we've discussed internally already, so.
Okay.
So as a member of the public, the only opportunity that will be available to the general public to make a comment would be through a survey. Will there be an opportunity for public comment that doesn't involve a focus group? Focus groups are predetermined individuals. They're not just open to the public. So how will that work?
Quite frankly, I don't know if we have anticipated that, so I can't answer your question at this point. It's something we may consider. Your point is well taken, but at this point, there's not just some large community meeting that is scheduled. Now, and so I'm just going to leave it at that. I'm not going to guess. Okay? Thank you. Anything else? There is nothing like the gift of time. And rarely has it happened with this commission. We were scheduled to go until 4. It's now only 2:35. And unless I hear a strenuous objection, we are adjourned. See you on the 1st.